Welcome back to it, guys. The Now Morning Show continues from talks of mental health to talks of drug testing, abuse, and other facets that we certainly can use support in. This morning, we are joined by members of the, and let me say it right, it's NDASA, the National Drug Association and Testing, is it? Mm-hmm. National Drug Alcohol Screening Association, of the USA, and making sure that we here in Trinidad and Tobago can do a better job of navigating drug and alcohol abuse. So joining us this morning is Mrs. Jo Maguire, the Executive Director for the National Drug and Alcohol Screening Association, as well as Mr. James Greer, the Chairman of the National Drug and Alcohol Screening Association, and Mr. George Gilpatrick. George Gilpatrick is a partner at Cahill Swift in Boston, which ultimately is going to be giving some consultancy information. So good morning, welcome, and thank you for joining us here on the Now. Now, this is particularly geared towards the conference that's happening on the 9th and 10th at the Hyatt Regency, where persons are going to be exposed to quite a bit. But tell us a little bit what exactly the NDASA is or represents. Can we start with you, James?
Sure. NDASA, the National Drug and Alcohol Screening Association, is the largest nonprofit trade association in the United States representing the drug and alcohol testing industry.
Right.
Our members include laboratories and medical review officers, physicians, governmental agencies, and so on. And we have a very strong international council that reaches out beyond the United States to help countries develop drug and alcohol testing regulations as it relates to public safety and drug-free workplace programs. So we're down here. I'm from Florida, so there's no better place to be when you're from Florida than in the Caribbean when there's a hurricane heading there. So we're down here holding some training, meeting with the business community, meeting with government officials to talk about enhancing Trinidad and Tobago's drug and alcohol testing requirements, and to basically educate the industry and the business community about the benefits of drug testing.
That's beautiful stuff that incorporates a number of entities. You mentioned government, the business sector, and of course the public will be deeply impacted. So Joe, tell us a little bit as to how regulatory structures for drug and alcohol testing will benefit the public safety specifically.
Absolutely. Well, the key word is safety, and we're really focused on workplace, and what we want to do is make sure that the policies and practices that are used for employee drug testing are fair, equitable, and standardized so that people always know what to expect. The employer knows what to expect. The employee does as well. And so whenever they come in to have their test, it's performed the same way every time. There's a laboratory-based result that has been confirmed. And so in this way, we're protecting the company liability, the employee liability, and the public safety.
Now, that sounds like it's going to be some very deep and intense sessions over those 2 days. Just to be clear, is it that you need to attend both days to be able to get the full gambit of information, or one or the other?
We think it is best. We're looking at not only an overview of best practice programs from beginning to end. We are also talking about accreditation program, which NDASA has a beautiful international accreditation program that we have a lot of members in Trinidad and Tobago that take part in that. So we want to help them understand that program. And then we also have a certified professional collector training all day Thursday so that collectors can get certified.
Good stuff, good stuff. So 2 days we should be there. But George, could you tell us a little bit as to what that would look like? Perhaps some of the actual helping or how they will actually improve alcohol testing in Trinidad and Tobago moving forward based on those sort of exchanges.
Yes, thank you. The first thing is to provide just the actual how-to training to the attendees. But then beyond that, it's making sure that, as Joe said and as Jim said, that the entire procedure is standardized, and it's predictable. It's following I would say a very specific, a literal rule book in some cases, but also a series of standards or a group of procedures or protocols that make it predictable, safe, fair, as Joe said, fair, and in a way that the integrity of the process is protected for everybody.
Now, that sounds like there will be some post-event follow-up and follow-through, so that we will perhaps see extensions of these sort of events, I imagine?
Yes, and earlier, Dr. Otello was talking about the idea of removing stigmas from some of this. And a lot of what we're talking about is, as you said, the follow-up, the after part of this. Removing the stigma from the process, removing the stigma from someone who might test positive for drug, alcohol, et cetera, and making sure that they're not cast off into the wind. They are actually given some form of rehabilitation opportunity.
There are misconceptions in the drug testing industry, particularly in the business community. Do you always have to terminate an employee? Things of that nature. So, as George said, standardization, answering questions, educating people about the benefits of drug testing is something that we want to do here.
We also advocate for workplace policies that allow for return to work programs. We have some wonderful models in the U.S. for second chances, returning to work, seeing a substance abuse professional, returning your employee to health and wellness. So all of these things are areas in which we can be helpful with those workplace policies.
Beautiful stuff. Now that means that it can appeal to a number of persons. So who should really attend? We're going to get training, we're going to get information the public could use, but who should be at this conference?
Anyone that is associated with drug and alcohol testing, but we also really encourage employers to attend who have workplace policies that we can help provide these pieces of information for. So those are our key target areas.
I'm thinking employers who also might need to get the information to implement them as well should be there. So that's everybody pretty much. But I imagine there is a number that you have to use at maximum. So tell me about registration, because we want people to make sure they come through.
Absolutely. We have about 50 spots left. So we are filling up fast, and we'd love for anybody who would like to register to visit endesa.com events, and then you'll see the Trinidad Tobago event is on the top of the list.
Of course we are. Now that means that, granted that there's a list, there are other locations, there are other things that will be coming up. Will we see you guys in Trinidad and Tobago's shores maybe?
We hope so.
Fingers crossed.
I hope so.
Of course. No, as much as you're relieved to not be in Florida, I imagine that the ability to connect digitally does exist as well, right? So is there, beyond the conference itself, will there be ways to connect with NASA otherwise?
Yes, we have a very strong website presence, a very strong social media presence. We have an annual conference every year. About 800 to 1,000 people show up. Medical physicians, drug testing facilities, and a lot of employers come too to hear. And we're having it this year in Jacksonville, Florida, April in 2025. So we encourage anyone. And with this new extension of our international commitment, getting out beyond the borders of the United States, we're hoping to have a large presence from other countries to come to the conference.
Well, making ground in Trinidad and Tobago is a great place to start. We like to be everywhere, as we were saying this morning. So getting this sort of information throughout the region is also important. Judge, if we were to try to access your expertise and your best practices, implementation, see the follow-ups, and even be able to measure the success of these sort of things, how can we connect with you as well?
All of us are available very easily by cell phone to all of our clients and friends, but also just online. We're all easily searchable, and I'd say for those who have read or practiced some of the standards and processes that are industry standard right now, internationally especially, you've already used some of the structures that we've all worked so many years to put together.
We can always be reached also at info@endesa.com, and we can help resource people to the specific individual they'd like to speak with.
Perfection. Now, Joe, granted that you are the founding chair, you can also give us a little bit of a message, if you will. Because while cultures may be different, localities and other challenges may impact how we use the information, I'm sure there are things that you have seen across the globe that always stand true. How do we navigate drug and alcohol abuse and reiterate the importance of this testing and support thereof?
A universal truth for all of us is that at the end of the workday, we want our loved one to come home to us safely. And that is something that we all share passionately when we really stop and think about it. And that's what we're all about.
And in that case, we encourage you guys to head on down to the Hyatt Regency on the 9th and 10th, after you've registered, of course, so that you can help be part of the solution. Alcohol and drug testing and best practices are going to be shared, and you can be a part of it. Check them out on the 9th and 10th at the Hyatt Regency. And for now, thank you, ladies and gentlemen, for joining us here on The Now.
Thank you.
Thank you.
Enjoy Trinidad, James.
I will.
We'll be back after these messages, guys.
For all that goes down.